So this is a quick talk to kind of update you all as patients that deal with ocular melanoma about the status of collaboration in ocular oncology. Many of you come from many centers. There are a lot of individuals who are at large institutions and also smaller institutions that are looking after patients with ocular melanoma. And what I wanted to talk about is some of the opportunities that we all have to work together. As we talked about, this is important as a community for patients and groups to come together, but also for us as clinicians to be able to communicate. And I wanted to convince you all today that that communication is robust and active. As we were talking during lunch, in other countries and actually in other disease populations, there is more of a nationalized system of organization of cancer care. So for example, in this country, pediatric cancers are almost entirely treated by a national consortium of protocols. So if I were a little child that had leukemia, for example, then I would be on a national protocol that is well understood, and that's how we move forward. Adult cancers, not so much. So in adult cancers, there's a lot of regional variation, as you're hearing, a lot of individual between doctor variation in terms of what we do. There isn't that consensus that you may have in other countries, like in Europe, where everyone in the country with a certain cancer is entered onto certain protocols. And I think it's just we have a lot of individual choices here and opportunities, but where we feel as ocular oncologists, we have an opportunity is to leverage our ability to work together. The key is the ability for ocular oncologists who deal with the primary diagnosis, the treatment and monitoring of patients to be able to make that connection for our patients with medical oncologists, radiation oncologists, interventionalists that are going to be doing these hepatic procedures and such. So I'm going to talk about 3 examples of how this is working today in the field of ocular oncology. The first is a group that's called the Ocular Oncology Study Consortium. This is a group of 9 institutions, and I was formerly at Duke, but we've transferred this now here to Stanford, that is now looking at data and what we call real-world settings. So there are currently 4 projects that are open now, one of which has been published and the other 2 are in review, that are looking at taking patients that have had genetic testing and looking at their response to things like radiation therapy, looking at their clinical features, and also how we do biopsies to take information that we can pass on to other individuals. The consortium is not just the individuals, institutions that I've mentioned, but I think many of you might recognize your treating physicians in this group, plus others that have been a part of it. And this is our first paper that came out in ophthalmology. So the Ocular Oncology Study Consortium is providing kind of real-world, trying to answer real-world questions with real-world data on how our patients are doing. You may have heard of staging of eye cancers or cancers in general, and we talk about this AJCC, or the American Joint Commission for Cancer Care, which is a way to categorize tumors and give us information about prognosis. We look at things like the size of the tumor, whether there's any involvement of lymph nodes, and whether there's any signs of spread of the disease. And that helps us to make staging determinations as to what stage the cancer is. And then based on data, we're able to then plug these stages into models that help us to decide what may be a certain patient's prognosis based on size alone, no genetic information. And we know that this classification system gives us really good best evidence for combining these clinical features and pathologic features. Now, in order for this to have been validated, it required a data set of over 5,000 patients from Europe that had ocular melanoma, because in Europe they did a really good job with keeping track of these patients. And using the classification system, they were able to gain that information. And it was validated by that international registry and also other single center studies that now incorporates into the 8th edition. And this upper study here was the European group that Professor D'Amato was also a part of, that gave really important patient data to help validate what what we use here in this country. And similarly, there are other international efforts that are combining the expertise in the United States and Europe to be able to answer questions about rare diseases. And I think we've all come to that understanding that we are dealing with a rare disease, and we need the power of the aggregate to be able to get that information together. And finally, the third scope kind of comes into the validation of this gene expression profiling test that we've heard so much about, where we're able to use this as a genetic test within ocular melanoma. Bill Harbour led the first collaborative ocular oncology group, or COOG, study that looked to prospectively validate whether this gene expression profile signature gives us information about survival and prognosis, and has been able to then tell us what class 1 means, class 2 means, 1A, 1B. Now, I will tell you that now in 23 centers across the United States, the COOG-2 study has started. So we're part of that study as well. You can see that it's involving many institutions across the United States. The purpose of this study is to prospectively understand what the PRAME aspect of the gene expression profile tells us, as well as you're hearing today, collecting other information that will also give us information comparing various types of tests for these patients. So collaboration is important, collaboration is active, and it happens across many levels in ocular oncology. So I'm happy to chat with any of you later today about this, but understand that we're asking more questions as we go every day, and with the help of all of our colleagues and our patients who help to answer these questions for us, hopefully we come up with important answers for us all. Thank you.